As the Parliamentary Health Committee has urged the administration of the Korle-Bu Teaching Hospital to promptly unlock the renal unit for outpatients within a 24-hour time frame. As per the Renal Patients Association, the closure of the unit has obstructed patients' access to vital dialysis treatment, leading to the tragic demise of 14 individuals. Kwabena Kando, the ranking member on the Health Committee, emphasized the need for the government to swiftly implement the necessary subsidies for dialysis treatment, condemning the insensitivity associated with the prolonged closure of the facility. Further details are provided in this report.
The Health Committee of Parliament has struggled to reopen the renal unit for outpatients at the Korle-Bu Teaching Hospital despite several meetings with both the government and the hospital's management. Alongside this, they are pressing the government to provide subsidies for renal patients to afford the cost of treatment. Kwabena Kando emphasizes the urgency of action to ensure affordable services for those with kidney diseases.
Responsible for health also assured us that as soon as possible, he was going to let them open the renal unit to OPD. Unfortunately, for the past 4 to 5 months, the renal unit has not been opened to the OPD. And we think that as a matter of urgency, whatever it takes, whatever subsidy that the minister was talking about, wherever we can get the resources, we have COVID levies, we have money that have been squandered through COVID, we have national health insurance, and this is an emergency, it's a national emergency. Government, as a matter of urgency, must put measures in place. If there's the need to absorb it completely, it should be done. If there's the need to provide subsidies, it must be done. But we must not delay. We must not delay because people need these services day in and day out. It is a fact that renal patients get their conditions worsened if they don't get dialysis. And so, whilst government is keeping on, people's conditions are being worsened, people are being pushed to their early grave, and we think that it's unthinkable, it is insensitivity of the highest order, and it must not be tolerated. We want to hear that within the next 24 hours, the renal unit of Korle-Bu has been opened. We have come here again, this is our second time of coming here. We have engaged the head of department. We've had a closed-door meeting with him, and yes, the story is the same, that the renal unit for the past 4 to 5 months has not been opened to the OPD. And we think that the needful must be done with immediate effect.
In a separate development, the Allied Health Professions Council has initiated a nationwide monitoring and inspection campaign to regulate service standards and ensure proficiency in healthcare delivery. Following visits to various hospitals, including the Ga East Hospital and the Pentecost Hospital, the Council is prepared to penalize facilities that fail to meet the necessary standards as per Act 857/2013.
Of course, I mean, the Act also indicates the kind of sanction that should be given to anyone for any any miscarriage of the regulations. The Act again stipulates or identifies what kind of sanctions should be applied, and of course we're going we apply these sanctions to the latter. Whatever it is that if you have a quack in your facility, what we do is that we ensure that the person who employed him and the person putting himself up in that position are both prosecuted, and we will do this without reservation to anyone or anything.
Concurrently, Dr. Franco Ususetre, the medical director of the Korle-Bu Teaching Hospital, stressed the significance of routine monitoring in preserving standards. He highlighted instances of misdiagnosis from the hospital's laboratory unit, emphasizing the potential risks to patients and the hospital's reputation.
Then you get a result, somebody's gone for dialysis, not passing urine, you get a result and it's normal. Urea normal, creatinine normal, everything normal, you see. And always when we ask for a relook, we get the right one. But the question I keep asking myself is, if I have seen this child on an OPD basis, probably would have made my judgment or decision based on that. And who knows, child might have ended up somewhere and then to have a negative reflection on all of us. So I'm particularly interested in the, we call it the regularization of the practitioners with the council. I think I can practice if by 31st of December I haven't paid my retention fee with the Medical and Dental Council